Good afternoon, everyone, and welcome back to our New Hampshire COVID Vaccine Alliance calls. We had a couple-week break, and thank you back for joining us. Again, the mission of the Alliance is to convene stakeholders in the granted state to promote vaccine competence, support accurate and consistent vaccine messaging, and foster coordination of vaccines allocation process. To do that, we promote public buy-in of the COVID vaccines to increase immunization rates, act as a force multiplier to support the state's communication allocation plans, and counter misinformation about the COVID vaccines when necessary, and foster use of New Hampshire's immunization information system. Next slide. I'd like to thank again our continuing sponsors, Harvard Pilgrim Healthcare, Anthem, Dairy Medical Center, Convenient MD, Wellson's Health Plans, and New Hampshire Healthy Families. All right, today's agenda, we have an exciting agenda for us. We're going to have the Honorable Chris Sununu come on and talk about the transition from a public dominated to a private sector vaccine allocation process. And then after that session, we're going to jump in and talk about New Hampshire AARP's It's Time for Family Reunions promotional campaign. And then we'll answer after that some general COVID questions. And I see that Governor Sununu is on. Welcome, sir. You can unmute yourself. And
hello.
Thank you for joining us in our COVID Vaccine Alliance meeting. Again, we just kind of went over our mission and our goals, and we thank you. And thank you for coming on to talk a little bit about the transition from a predominantly public vaccine allocation process to a public sector kind of dominated process. And we know you've been talking about this for a couple months. We know that some of the public sites are wrapping up at June, and I'll just hand it over to you if you can kind of give everyone some insights, kind of what's going on and how these private sector stakeholders can play an important process in the vaccine allocation process going forward.
Sure. Well, no, thank you, Jim. And first, I just want to give a big thank you to everybody. It has been a pretty incredible 15 months or whatever it is. I can't even keep track of the months now. It's been a long road for all of us. I say it all the time. We all have our own stories. We could probably all write novels about what COVID did in terms of our families, our businesses, the public health scare, education and kids, and we could go on all day about it. You know, the folks, a lot of the folks that are on the call here today, you know, while obviously the state and the public sector had to take a driving role on all this, none of it happens without the good partnerships. It doesn't. From the hospitals to the providers to the pharmacies, everybody was in the mix. Everybody was an all hands on effort, all hands on deck effort, and everybody really supported what ultimately has become one of the best stories in the entire country. When you're ranked one of the safest states in the country, getting vaccine out faster than pretty much anybody else in the country, having one of the strongest economies in the country, and all of this kind of good stuff. As tough as it has been here, we've really weathered through this better than almost anybody else. And as a reminder, America as a whole has weathered it pretty much better than anybody else, any other country on the planet. I think we because of all our flexibilities and things are quote unquote getting, and if not already back to normal, I think we forget that the worldwide pandemic is still very, very much in motion. One example of that is I'm trying to give our vaccine to Canada now. I mean, you were trying to open that border, anything to be helpful. This is the first week that New Hampshire isn't really taking our full allocation of vaccine because right now we just don't have nearly as many takers, and we've gotten it out so fast. So anything we can do to share in that success, and frankly, all of New England has done a very, very good job, but anything to share in that success to open borders and create flexibility is very important. Now, what we're talking about here today is that transition, and Harry Plummer and Lori and Fallon and all the team members, Dr. Daly, everyone has really been working hard over the past couple months to make sure we make as smooth of a transition back to the healthcare field. That's where all this stuff should be anyway, right? We want healthcare providers, you know, working with patients, making good healthcare choices for themselves, for their families, and obviously that's best done by the providers themselves, not the government, so to say. We had to, and I think we did a good job stepping in a pandemic and getting it out and really driving I think, a lot of efficiency, if you will, with the mass vaccination. But now we really want everything to transition over, and rightly so. And we have less National Guard that we need and that we're utilizing. We have less volunteers that we need and utilizing, less issues with unemployment. So things are really coming back to normal from the state perspective. But there does need to be a transition, making sure that everybody knows what the guidelines are. We want to make sure that everybody knows where to go to get their questions answered. As a provider, as a pharmacist, whatever it might be, who do I go when I have a question about this or that? Who do I go when I know I want to order a certain amount of vaccine? Handling the vaccine itself requires some understanding and education, just because it comes in the vials and what happens with the waste and how do you avoid waste. We've gotten really, really good with the tricks of the trade, so to say, of making sure we're avoiding waste and spillage and all that kind of stuff, and anything we can do to make sure that we're kind of passing on those best practices. We want to make sure that everyone who wants to be part of the process can enroll in the process to be vaccinators. And there are some providers out there that, for whatever reason, might not feel comfortable at this point, or might not be situated in a position to provide vaccine, and that's fine. A lot of these providers are part of larger networks, and so they have other resources. Some are more independent. But we, in New Hampshire, one thing I really want to emphasize: we're a fairly small state. We're very nimble when it comes to government. We can move very quickly and I think very efficiently. And that allows us to kind of create one-on-one relationships and connections with all the different providers and opportunities that are out there in both the public and the private sector. So that's very, very important to us. And I think that's why we're just faster and frankly just better than a lot of other states, because we can be nimble and we can deal with folks one-on-one, deal with issues very quickly at a very personalized level, as opposed to just staying up here at 30,000 feet and saying, well, we're just going to hand out some money and provide some basic resources and you guys take the rest. We really want to be there especially as we go through the transition. I feel very confident it's going to go very smooth. I think a lot of the pieces are already in place. I guess that's it. I could, I can go on all day with my press conferences. People get enough of that. I get it, but I can open it for questions or go away quietly. But we really have, I can't say enough. The team here in New Hampshire has just been exceptional, really, really exceptional. And a lot of you know them by first name now, going through this whole process. And again, we just want you guys to know that you can lean on us for questions or answers or explanations in terms of the hows and whys we're doing things, and make this transition seamless, not just for ourselves, but most importantly for the citizens. And it's those that are vaccine hesitant, that 30% maybe that's still vaccine hesitant. I think there's a strong opportunity to get a lot of folks, because they just want time to spend a little more time with their doctor or spend a little more time with whoever to think about it, to understand the vaccine. And then obviously having their doctor work with them one-on-one to help them make those decisions, I think is going to just help us keep the vaccine moving forward, as opposed to just come to a screeching halt. We've done a great job, but there's no reason that I think with the help and the assistance and leaning into the providers a little bit, that they can't help really get us that much further ahead.
Well, Governor, thank you very much. You summed it up great. And yes, I have to commend you and your entire administration, everyone that's been involved in this effort. It's been fantastic up to this point. And we look forward collectively as kind of the private sector stakeholders to help see this through the finish line, through the summer and the fall, to make sure that we get communities up to community-wide immunization levels. As I understand, by the end of this month, maybe we'll be about 60%, have vaccination rates somewhere in that neighborhood. And the goal will be get to that next 10, 20% over the next few months, and as we go into the fall with the younger children cohort. So to answer, we have a couple of questions, and I've asked our partners from the New Hampshire Hospital Association and the Business and Industry Association to field a couple of these questions. So Kathy, can you ask the first question of the governor?
Sure. Good afternoon, Governor. Thanks for joining us today. And Kathy Bizarro-Thunberg, Executive Vice President, New Hampshire Hospital Association. And as you know, the hospitals have been involved since day one, and we're actually in week 26 of hospital allocations for doing vaccinations for their staff, for their patients, and for the communities. And with that, I just wanted to know if you could give us an update on the current vaccine efforts and how vaccines will be delivered now that the state fixed sites are closing as of the end of the month.
Sure. Well, I mean, look, the current efforts, I think, as a lot of people understand, have gone very, very well, very, very fast. And I think as we close down and have kind of stopped giving first shots for individuals at our state vaccination sites, they will still remain open for those second shots, just for continuity for those citizens. And then moving forward, if folks want first shots, right now we're directing them to the pharmacies who have been doing that work in that program. Vinny will still remain to be up and running, and folks are still, using that system to schedule those first shots, and then the second shot gets automatically scheduled for them following that. And then all these providers will now come on board, and if they want the vaccine, they can put their orders in for the vaccine, and that transition is really already well underway. And some of the folks at HHS and can probably speak a little more to the logistics of that. But I think there's been some good conversation. It sounds like most of the providers understand the process. We'll still keep drawing down a vaccine really based on what we see the need is. We don't want to over draw down because the vaccine can go bad. It can spoil, so to say. So we always have to be careful not to draw down. We want to draw down what we need, maybe a little extra just in case. And we'll continue to do that. And that's through the state process and system. Obviously, the federally qualified health centers will still have their system. The VA will still be getting vaccines through their system as well. There's a variety of different avenues that will still remain open that the federal government still contracts with directly. But this month is really where we transition to those first shots.
Great, thank you very much. And which providers are able to receive the COVID-19 vaccine, and how will DHHS decide who to onboard first?
So it's my understanding that providers are going to receive training basically with the New Hampshire Immunization Information System. I think I don't know about that acronym correct, the NHIIS, and that's part of that onboarding process. And then again, I think we're kind of intaking how many there will be, who's interested in actually participating, making sure we have geographic and regional coverage. If there are a lack of providers in one part of let's just say a rural part of the state, we'll likely put a little more of an emphasis there because we want to make sure that we don't have gaps, at least geographically, in the system, because we know that whether it's networks themselves or actual individual providers, that's how far you have to go to get the vaccine is sometimes a limiting factor there as well. So we did do a survey of like 100 to 150 healthcare organizations who had submitted agreements as part of that immunization program. So I think we have a pretty good sense of where the need is and how it's going to work. And we're going to be contacting everyone who responded and who's interested. So we're going to, again, make that reach out on a very individualized basis and start opening those doors.
Thank you very much.
Perfect. Jim, could you introduce yourself and ask the next couple of questions, please?
Sure. Jim Roach with the Business and Industry Association. Good to see you, Governor, and good luck with the end of the session. This will be interesting next couple of weeks for you and all of us. The question is, can providers still be a part of the COVID-19 vaccine effort if it had not yet submitted a COVID-19 provider agreement or filled out the application? Are they still able to become a provider?
Yeah, absolutely. If you're a provider and you want to be part of the system, absolutely. You can still get the COVID-19 provider agreement. There's a website. I don't have the website off the top of my head, but we can dig it up and get it for you. But yes, the quick answer is absolutely. Even if you haven't been part of it yet, you can come on board at pretty much any time. We're not putting a cutoff date there. And again, we'll kind of go through that approval process, go through the training process, and get folks on board as quickly as possible.
Great, thank you. Another question is, given that the vaccine now comes in multi-dose vials, it seems like it's going to be harder and harder to find enough people to use all the doses in the vial. Any recommendations on how providers should deal with that?
That's a great question. In fact, kind of as an aside, it was 3 or 4 months ago when they're like, so we're going to start putting it not in 4 or 5 doses per vial. We're going to go to 15 or 20. And all the governors were like, no, don't do that. I understand it's easier for the manufacturers to do that, but we all realized quickly how bad that would be in terms of spoilage. So, there's a couple different ways to do that. And I think to minimize the waste, if you will, we've heard some folks that will say, okay, we're going to, just get everyone who wants a vaccine this week, we're going to put them all on Friday morning, right? You lump them together, if you will, by time. Or providers that are part of larger healthcare networks, again, doing the same thing. Kind of, I might go to Dr. Smith, but Dr. Smith is part of, the core provider network. So, everything is kind of funneled to one central location, similar to what we kind of did in the state level with our mass vaccination sites. But, once per week, everyone's going to come in the more people you can put together in a single point of time, that's how you minimize the waste as best you can. So I think that's really the best thing I could offer, and that's really what we tried to do at the state level. And it, for the most part, it worked really well. A lot of our spoilage, by the way, our breakage, if you will, because it was so cold. Remember, we were trying to get vaccine out in the middle of January and February. And, you know, if you remember, there were scenes at those vaccination sites, they would literally put the vaccine in their up against their body inside their coat just to keep it from freezing. And sometimes it would freeze or the needle would break or whatever it might be. So we were able to really minimize the wastage, but it's all about just getting more folks together, more networks, more providers, more folks that are interested in being part of this provider network, you know, to kind of commingle, if you will, in a single point in time, as many patients as you possibly can.
Thank you, Governor.
Right. Last question we have. Is there a way for providers to see if their patients have received the COVID vaccine?
Oh, yeah, sure. Yeah, you just go on the New Hampshire immunization system. You can absolutely go on that as a provider. You can go on that system and see who has, you know, see if your patients have received the vaccination. You can see when it was received. The when could become very important at some point if we don't know what's going to happen with boosters, right? They could say everybody 75 and over next year really needs a booster shot. There's no indication of that yet, but I think everyone knows that that's on the table. So having access to that information, having access to the when, getting a shot in January versus getting one in April, you know, could make a big swing of things, so to say. Making sure that folks, remember, as folks come into long-term care systems, they're all going to be able to get the vaccine, you know, when they come into the long-term care systems through their long-term care pharmacy providers, similar to as you would get a shot of a flu shot now or whatever it might be. You know, back when this all originally started, our goal was to say, we want this to be as easy as getting a flu shot. And that's exactly where we want this to go. Fundamentally, it should ultimately work just the same, maybe with a yearly booster, but obviously providers will have access to that information, and you know, we can go from there.
Great, Governor. Now, we know your time is precious, and we thank you for you know, talking with all the stakeholders of this alliance, and we'll make sure that this information gets out to everyone. So thank you for joining us today. Any final comments before you leave us?
Well, no, just I guess one last thing. I was just handed a piece of paper. Thank goodness I have people that know all the details. If you just go to our main COVID website, which a lot of folks know is covid.nh.gov, there is the vaccine tab there. And I didn't realize this. If you just click on that vaccine tab as a provider, you can learn how to sign up and to administer the vaccine. So we're trying to make it, again, very easy. It's the covid.nh.gov website. A lot of folks have already been there. That's where our dashboards and things of which are. Click on the vaccine tab, and there's something there for providers if you'd like to sign up and do it. And we just want to make it easy and as seamless as possible.
Governor, again, thank you for joining us. You've done a great job. We look forward to working with you to get us over the finish line here.
You bet. Thank you, guys. Great work.
All right.
Thank you.
Take care. Brian, can you pull up the rest of my presentation? We'll kind of go into some of the details that the governor talked about a little bit. Next slide, please. So from our recent Alliance discussions, just wanted to remind you that you can go to the Medical Society's website and you can hear about legal issues about the transition from Dr. Ballard, and you can talk our discussion with Dr. Beth Daly and TW about implementing the IIS. Next slide. And then the takeaways from May that on the IIS is that the 7-day reporting requirement are temporarily waived, which means that clinics won't need to report the data or provide dose-by-dose accountability until they request new vaccine. So IIS is only requiring reporting for those vaccines supplied by the state. For the dose-to-dose documentation before the reordering. As many of you know, the HL7 messaging code has been released, and that process, that 6-step process, is there at the web address that you can see there, and it'll take you through each of the steps. Whenever there's staff contacts, everything that you kind of need to help walk through that IIS onboarding system. Next slide. So again, just for kind of go over the big things for preparing for the transition, sign up and have your staff trained on IIS. Make sure you have the operational administration functions in place, including protocols for vaccine waste storage handling requirements and the data entry requirements. Protocols on how to have workflows to help achieve health equity and address vaccine ambivalence and hesitant populations. There are some sources there on the page for patient information, promotional information. And when we publish this on our website for this week, we'll have some other sources that you can go to that are from the national or federal programs. Next slide. So as you recall from our last meeting, at the request of the Division of Public Health Services, we surveyed 23 independent pediatric and primary care practices to really ask them, what will it cost? What are your needs as you become part of this vaccine allocation process? And those startup costs were identified as the manual entry prior to HL7 integration, IT enhancements to allow the HL7 interface, and workflow changes, as well as storage for some of the vaccines and waste system upgrades, as well as vaccine promotion, communications, and marketing. Next slide, please. And so with the allocation process, there's going to be some federal funding available for 3 sectors. First, for independent primary care practices. Next, for federally qualified community health centers. Next. And third, for hospitals. Next slide, next return. So these federal funds, the application and distribution process is anticipated to occur later this summer. Those contracts are under development right now. We hope that they will be signed in early July. We're already the various individuals involved in being the fiscal agents for these federal loans are kind of working for that end. But right now, I think our best guess is later this summer, those applications and distribution of funds will be available for the cost of moving into the vaccine allocation process. So track your time, keep your information as you go on ramping up. Keep that available. It's very likely that, well, retrospectively, we'll be able to reimburse you for some of those costs. Next slide. We lose the program there, Brian. Let's try it again. Oh, there we go. Just before we go into the next program, I wanted to let you know that we will be having an Alliance call next Tuesday from noon to 1. And we're going to be focusing on the issue of mobile vans, both public and private, how those are now coming online. We'll talk about both those that are available at the state, the regional public health networks, and a number of private entities that are just starting up mobile vans in various parts of the state that are kind of focusing on immunizations, primary care, and public health education efforts. So tune in next week for that topic. All right, why don't we, final reminder is there are other COVID information sessions. The healthcare providers session is with Doctors Chan, Talbot, and Daly is on Thursdays. And that's on a weekly basis still. Education childcare is the first and third Wednesdays, and long-term care health is also on the first and third Wednesdays at different times. So with that, now I'd like to transition over, if we could, to the next portion of our program. And I'd like to introduce Todd Fahey and Pamela Dewey from the AARP of New Hampshire to talk a little bit about their new campaign to help support COVID-19 vaccine promotion. And so, Brian, you should have that next set of slides, I hope, that you can pull up. There we are. Okay, and so turn it over to Todd and Pam, if you want to turn your cameras on.
Hey, Jim, they won't let us. Oh, now we can turn it on. Yes.
There we go.
We jumped the gun before. So hello, everybody. Thanks for having us on. I am Todd Fahey with my colleague, Pam Doobie. Pam runs our communications at AARP New Hampshire. And I'll just give you a little overview, then let Pam take it away. So we are an organization that's a nonpartisan organization of about 215 to 225,000 members in New Hampshire. Those people being people over 50 plus. So we are obviously very concerned about the take up of the vaccine and all related things, given that at least before we got somewhat ahead of the pandemic, people who are over 50 and those with underlying conditions were bearing the brunt of the pandemic's wrath. So that was point one. So we remained involved. Point two, which is very important, is that we are not public health experts. And although we had opportunities to speak a lot in the midst of this and to do what the governor said, just to be another voice trying to, all join forces to get Granite Staters through it, we were very careful not to speak as if we were public health experts, like the Hospital Association, like the Medical Society, and all the providers who work with all of you. We know what we are and what we're not. But what we did is we did a lot of public relations. We talked to our members a lot of one-on-one contact, mostly through the good work of Pam Doobie. We did countless teletown, well, not countless, but many teletown halls, countless Facebook posts and things to get the message out. And so it's simply, I'll pause here, then turn over to Pam. Here's the upshot for AARP New Hampshire. We are not telling people to take or not take the vaccine. What we are telling people to do is to be sure that that decision is founded in fact and based upon the best information available to them. So as the campaign seems to morph towards a one-on-one, more intimate, coaxing educational campaign, we thought we could maybe join up with the Medical Society and the providers to amplify that one-on-one message. So with that, take it away, Pam.
Great, thank you. Jim, thanks so much for inviting us to present today. And also thank you so much for partnering with us in this new campaign. As Todd said, we have been tracking this right along and informing our members for many months. And we have found that our AARP members and folks who are 50 plus have been very receptive to getting the vaccine, as well as, really looking at the information that we're sending out. So we thought now that the state is transitioning from private to public vaccinations, and those one-on-one conversations with doctors are more important than ever, that the next phase of this for us is going to be a campaign called It's Time for Family Reunions, where we are really capitalizing on the pull that folks who are 50 plus have within their family. They're the elders in their family, the people, younger folks might go to for advice, and really the ones who help disseminate some great information to younger family members. So that's how we came up with this campaign. Could you click forward for me? Great. So the purpose of the campaign is to encourage New Hampshire residents, of course, with a focus on those who are 50 plus, to engage in one-on-one conversations with their healthcare providers about COVID-19 vaccines. And the message is simple. COVID-19 vaccines allow for all kinds of safe and very long overdue family reunions. So we thought It's Time is the perfect message to get out there. And how we will do this is through social media promotion predominantly, also capitalizing on media opportunities that come up, and also a possible print campaign. Next slide, please. So this is what it's going to look like. Lots of different ways that people can reunite. And these will be put on social media weekly. So it's going to be time to hold hands, to celebrate birthdays, to catch up, to gather, to spend time together, time to hug. This is just 6 of about 18 of these that we have made up. Very visual, intergenerational, families doing those things that they just haven't had a chance to do, haven't been able to do safely. And so along with these graphics, next slide, please. will be copy on Facebook and Twitter. And this copy is still in draft format, and it's obviously subject to change based on the circumstances in the state and the messaging we want to give out. You know, obviously the messaging that we're getting out there is emotional. We want people to connect on an emotional basis and really think about all the things they've missed with grandchildren and maybe with their own children. So text copy will read something like, this is a great time to celebrate a big day together. Did you now know that New Hampshire offers walk-in COVID vaccines at lots of locations near you? Click here to learn where, and then we'll tag AARP and the New Hampshire Medical Society. But the messages will change. You know, it's a great time to gather with family. If you aren't sure about getting the vaccine, this is a great time to have a conversation with your healthcare provider. You know, residents of all ages can now be vaccinated. So we're playing a little catch up with where we are in the state for people who have missed it, because believe it or not, there are people who don't have this information yet. And it's important to restate some of this along with the new information. So next slide, please. And the timeline. You know, as the governor just said, we are in this transition phase from public to private. So this is a great time to launch this. It's something new and different in the state, and there'll be eyes on it again. So as vaccines transition to physicians, urgent care offices, hospitals, community health centers, pharmacies, and other places, that's when this campaign will run. So probably starting in the next week or so. And then the campaign will run through September 2021. And then we will take a step back, look at where we are in the state, and see what the next phase of the campaign should look like.
Well, Todd and Pam, thank you very much. This is right on target to what all the national organizations who kind of focused on this messaging about making the emotional appeal to get back to things that you love doing. And so thank you for pulling together this great campaign. We hope that all of our stakeholders can take these messages and on the various social media and forward them on to your organizations and your members. So this is a great start. If other organizations are doing similar things, really appreciate it. This is going to be really the tough sledding for the next few months. We're going after those who, for whatever reason, haven't gotten their vaccine, so they've hesitated up to this point. So this next 10 to 20% is going to be the hard slug, and that's where we have to come together, and we have to kind of boost our efforts and use those people that are trusted family members besides providers and practitioners. So everything that we can do over the summer and into the fall, when we bring on the childhood cohort with that, when we tried to redouble our efforts in August and September for the middle school and high school audiences, those kids, so we get as many of those as possible. So we get those numbers up. So if there's a variant that comes through or a spike happens in New Hampshire, we can be on top and help mitigate those as we move forward. So Pam and Todd, thank you very much for putting this campaign together. We look forward to it being rolled out over the next couple of months. Any kind of concluding comments, anything else that you'd like for the audience to take away here?
No, I would just say, I'm just very proud. It sounds a little hokey, but I'm kind of proud to be a Granite Stater right now, right? We pulled through this, we showed who we are and being nimble and all the organizations pulling together. And I grew up here, I love the state. And to see where we are now and to actually see how we're gonna deal with this last 10 to 20% hard slog is just very inspiring. So we're really happy to be a part of it. Any questions, I'm at tfahey@aarp.org. And I know most of you are easy to find, and anything you need from either Pam or I, please just reach out. Happy to chat.
Great. We'll include in the packet that we'll have later today, we'll include that contact information. So if you have questions or you want to get more involved, with this campaign, then we'll put you in direct touch with both Todd and Pam. Again, thank you very much for the time and what you've been doing here. And we look forward to hearing more about as the campaign rolls forward. Thank you again. We have just a couple questions here, and please, if there's anything that we haven't touched upon here about this next phase, or you have questions, this will help us move into this next phase and help address. And the first question that we have here from Stephanie is, when will providers who are interested in being a closed pod be eligible to receive vaccine supply? So Stephanie, that's actually occurring as we speak. So we know a number of practitioners and offices have already been contacted, and I believe are seeing supply this week because of. So if you haven't been contacted yet, couple ways there. You can email the New Hampshire IIS, and it's available on their website, or you can email me with your contact information, and I'll make sure that that your application is followed up on as we're moving forward. As was noted here from Stephanie, yep, last week they were talked to and told to open up a pod. Any indication of when single dose vials will be available for any approved vaccines? That's a great question. I think that is, as the governor kind of mentioned, and as I've discussed with a number of individuals at the Division of Public Health Services, I think this is part of a transition process. Remember, other parts of the country are still lagging substantially behind us and still are trying to do big mass vaccine sites. So I think probably through the summer and probably into the early fall, when we still have new cohorts coming on, I think the manufacturers are going to probably stick to the vial size that they're dealing with. After that time, and again, depending upon if boosters are needed, then I think what you'll see is, like other vaccines, that those will get into the single or smaller doses as we move forward. So it's been in discussion. I know that the White House, the federal panel, has been discussing this. Dr. Chan and I have this discussion, have had this discussion a number of weeks. And so the issue is out there, but I think we just have to keep in mind there's other parts of the country that are really still trying to ramp through their big, their large centers. We're just in New England, New Hampshire, we're a little bit ahead of the curve. I think it will be a challenge with some of these, particularly at smaller sites, on how that's managed to prohibit waste or breakage. And so perhaps at a future time, we'll have someone from who has been kind of experienced in with the public sites, how they have developed some specific strategies and move forward on that particular issue. So kind of in a little bit of a no man's land on that, but I think you will probably, the vaccine supply that we're going to get probably through the summer is still going to be the larger vials. All right, I'm just looking for any other questions here. Let's see. I think that's all that I'm seeing right now. If you have any other questions related to this transition process, if you're having problems contacting the Division of Public Health Services, or if you're going through and you want to apply, as the governor mentioned, if you go to the NH COVID vaccine site, you'll see a pull down tab for vaccines. Under there is a specific area where it has both the application that you can do and send in, plus kind of the FAQs and things that you have to kind of consider and move. And so that is, that address is https://www.covid19.nh.gov/. So we'll keep moving forward. and on this. And if we don't have any other questions, then I thank you very much, everyone. Todd, Pam, Jim, Kathy, Steve Anand, all of our other contributors, our stakeholders that regularly come on here. Jim, you have a question, go ahead. Oh no, you're just saying goodbye. Okay, well, goodbye, but thank you again for all your support. And be back next Tuesday, where we're going to be talking about both the public and the private mobile vaccine efforts that are beginning to roll out. And I think this will be a really interesting discussion about how your organizations can engage with both the public and the private vans that are being developed, and how you can use them effectively to target for immunizations or primary care, or even just public health education. I think that's where some of these vans, and I happen to be part of one of the efforts, and it's a really kind of a fantastic effort that's kind of going forward. And we're going to kind of get into and have various presentations on what those mobile entities are kind of working on right now, and how you can potentially engage with them. So again, thank you all, everyone, for your time and participation, and we'll look forward to seeing you back next week at this time and location. Take care, everyone.